So before your diagnosis, probably nutrition had a little bit to do with what realizing you needed to go in because you were having some reflux and things like that, right? So that's related to nutrition.
Right.
Hmm.
Before that, I always tried to eat pretty healthy. I didn't overeat. I wasn't someone who gouged a lot on food. I tried to eat healthy. As I have stated before, I was a bus driver, so um, my dietary habits and my eating patterns and schedule were difficult.
Hmm.
A lot of times I would have to eat and work at the same time, so I would never be able to sit down really and take 30 minutes, a half hour, 45 minutes for lunch,
Hmm.
eat, relax. But I would have to eat and run, eat and run, eat and run. And normally I wouldn't get my major meal until after I got off from work. And
Hmm.
as soon as I finished eating, I would go to sleep. So
Oh,
that happened over a period of time. And once I started developing a feeling indigestion and heartburn and feeling like my food was getting stuck in my chest,
hmm.
I thought it had something to do with the way I was eating and going to sleep on my food. So I didn't think a whole lot about it
Hmm.
until it kept occurring over a
Hmm.
period of time.
Hmm.
I went to my general practitioner
Hmm.
and I got checked for acid reflux. They
hmm.
checked me for the H. pylori virus. And I kept coming back negative.
Hmm.
And then he prescribed, or he asked me, he said I could take some Tums. When I feel indigestion, just throw in a couple of Tums and be on my merry way. And I did that, and I did that for a while. I guess that would 6 months, 8 months,
Yeah.
and things started to seem to get progressively worse.
Hmm.
It
You
finally got
know,
to the point where I was having indigestion even when I
right,
wasn't eating. So
right.
that was really raised a flag for me when I
Yeah,
would just have indigestion and heartburn and I wasn't eating.
right. So your story is exactly the same as Dr. Patterson, who had the total gastrectomy and, who we talk about a lot as, being, was my mentor and has been an example for stomach cancer patients because he was also working a job where he didn't have time to stop and eat. It's terrible to say this, and he even said it was terrible when he said it, but he would even eat on the toilet, like in between what he was doing at work because he didn't have time. Like he just run in there with it. I mean, that awful, but how many people work like that? Where you really don't have time to eat and you take a quick bite, run in, run to do whatever you need to do. Like you said, you've got a schedule you have to keep and you have to be precise. You can't just hop off that schedule, take 15 minutes to eat or whatever you want to do. But then he was having so much indigestion. So I really think that I don't, obviously that doesn't cause cancer, but I do think that so many patients have the story of not overlooking, but going a lot longer with those symptoms of reflux and everything because they assume, well, I lay down when I eat, or I eat right before I lay down for bed, or of course I'm having reflux. I'm so rushed and everything when I'm eating that by the time they go to get help, and then the same thing with him, the doctors were just saying, take this, take that, assuming it's stomach acid, etc. Well, you can start popping so many antacids before you realize this isn't doing it, and then you finally get help. And that prolonged period of time, it does decrease the amount of time before you get diagnosed. So I think people who are having like any reflux, get in there right away and make sure that, there's nothing else going on. It's so
I,
much easier to get tested for H. pylori now too. So go ahead.
I